All right, let me think really fast. The perfect day? Waking up at home with my husband and my dog, Wesley. Probably going out on the boat for a morning boat ride. Maybe going out in the backyard, catching some crabs, which is our favorite thing. Come back home for a lunch, get ready, go out for a happy hour, and then coming home and probably cuddling up on the couch and watching a movie. I am completely dairy-free. I cannot have any dairy at all. No milk, cheese, no butter, no cream. So I cheered growing up on the all-star team down the street. We got to travel all around for it, but that also posed risk for me eating out at different places, for us not knowing what the local restaurant was gonna look like, if they were gonna be able to keep me safe while eating there. We would travel somewhere, get my own snacks. I always carried around my purse with me, which carried epinephrine as well as albuterol for my asthma. I was taking some sort of rescue medications for accidental exposure to milk 1 out of every 3 times that I ate out at a restaurant. Growing up, I remember a couple different examples of times where I had gone to other children's birthday parties, ended up having severe reactions from simply cross-contamination on a table. I had touched my skin afterwards or my eyes afterwards and ended up breaking out in hives. My mother, growing up, was a NICU nurse. She did all of the research possible when it came to food allergies, what the different names were for what milk is called. There's 100 different names that could be listed on an ingredient list that would contain milk in it. I think it definitely made her much more vigilant in just being precautious with my allergies. She knew the severity of it and what could potentially happen if I was exposed. Like I said, she's been my biggest advocate since day one. And
there have definitely been times where I feel like I am a burden because of the severity of my allergy, because of the hoops that I have to jump through, the precautions that I have to take to make sure that I'm keeping myself safe.
Although XOLAIR has the potential to lessen my risk of anaphylaxis from my food allergy, our lives revolve around food. It's not always easy for me, but for the most part, we make it work.
Obviously, I still avoid milk and carry epinephrine, but I know that if an accidental exposure happens, I have help.
XOLAIR has definitely changed the way that I look at my allergy.
What is XOLAIR? XOLAIR, omalizumab for subcutaneous use, is an injectable prescription medicine used to treat food allergy in people 1 year of age and older to reduce allergic reactions that may occur after accidentally eating 1 or more foods to which you are allergic. While taking XOLAIR, you should continue to avoid all foods to which you are allergic. It is not known if XOLAIR is safe and effective in people with food allergy under 1 year of age. XOLAIR should not be used for the emergency treatment of any allergic reactions, including anaphylaxis. Important safety information. What is the most important information I should know about XOLAIR? Severe allergic reaction. A severe allergic reaction called anaphylaxis can happen when you receive XOLAIR. The reaction can occur after the first dose or after many doses. It may also occur right after a XOLAIR injection or days later. Anaphylaxis is a life-threatening condition and can lead to death. Go to the nearest emergency room right away if you have any of these symptoms of an allergic reaction: wheezing, shortness of breath, cough, chest tightness or trouble breathing, low blood pressure, dizziness, fainting, rapid or weak heartbeat, anxiety or feeling of impending doom, flushing, itching, hives or feeling warm, swelling of the throat or tongue, throat tightness, hoarse voice, or trouble swallowing. Your healthcare provider will monitor you closely for symptoms of an allergic reaction while you are receiving XOLAIR and for a period of time after treatment is initiated. Your healthcare provider should talk to you about getting medical treatment if you have symptoms of an allergic reaction. Do not receive and use XOLAIR if you are allergic to omalizumab or any of the ingredients in XOLAIR. Before receiving XOLAIR, tell your healthcare provider about all of your medical conditions, including if you have a latex allergy or any other allergies, such as seasonal allergies. The needle cap on the XOLAIR pre-filled syringe contains a type of natural rubber latex. Have sudden breathing problems, bronchospasm. Have ever had a severe allergic reaction called anaphylaxis. Have or have had a parasitic infection. Have or have had cancer. are pregnant, or plan to become pregnant. It is not known if XOLAIR may harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if XOLAIR passes into your breast milk. Talk with your healthcare provider about the best way to feed your baby while you receive and use XOLAIR. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I receive and use XOLAIR? When starting treatment, XOLAIR should be given by your healthcare provider in a healthcare setting. If your healthcare provider decides that you or a caregiver may be able to give your own XOLAIR pre-filled syringe or auto-injector injections, you should receive training on the right way to prepare and inject XOLAIR. Do not try to inject XOLAIR until you have been shown the right way to give XOLAIR pre-filled syringe or auto-injector injections by a healthcare provider. Use XOLAIR exactly as prescribed by your healthcare provider. The XOLAIR auto-injector, all doses, is intended for use only in adults and adolescents aged 12 years and older. For children 12 years of age and older, XOLAIR pre-filled syringe or auto-injector may be self-injected under adult supervision. For children 1 to 11 years of age, XOLAIR pre-filled syringe should be injected by a caregiver. See the detailed instructions for use that comes with XOLAIR for information on the right way to prepare and inject XOLAIR. XOLAIR is given in 1 or more injections under the skin, subcutaneous, 1 time every 2 or 4 weeks. In people with food allergy, a blood test for a substance called IgE must be performed before starting XOLAIR to determine the appropriate dose and dosing frequency. Do not decrease or stop taking any of your food allergy medicine or allergen immunotherapy unless your healthcare providers tell you to. You may not see improvement in your symptoms right away after XOLAIR treatment. If your symptoms do not improve or get worse, call your healthcare provider. If you inject more XOLAIR than prescribed, call your healthcare provider right away. What are the possible side effects of XOLAIR? XOLAIR may cause serious side effects, including cancer. Cases of cancer were observed in some people who received XOLAIR. Fever, muscle aches, and rash. Some people get these symptoms 1 to 5 days after receiving a XOLAIR injection. If you have any of these symptoms, call your healthcare provider. Parasitic infection. Some people who are at a high risk for parasite worm infections get a parasite infection after receiving XOLAIR. Your healthcare provider can test your stool to check if you have a parasite infection. Heart and circulation problems. Some people who receive XOLAIR have had chest pain, heart attack, blood clots in the lungs or legs, or temporary symptoms of weakness on one side of the body, slurred speech, or altered vision. It is not known whether these are caused by XOLAIR. The most common side effects of XOLAIR in people with food allergy: injection site reactions and fever. These are not all the possible side effects of XOLAIR. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Genentech at 888-835-2555 or Novartis Pharmaceuticals Corporation at 888-669-6682. Please see full prescribing information, including medication guide, for additional important safety information.